Morning, everyone, and thank you for joining us today. I'm Bill Koehler, CEO of Team NEO. For those who are less familiar with Team NEO, we are a business and economic development nonprofit focused on building a vibrant economy in the 18 counties of Northeast Ohio. We are focused on delivering unique insights based on robust data analysis in everything we do in order to inform conversations, encourage strategic alignment among complementary initiatives, and enhance the impact of those initiatives, thereby driving regional growth. And we work to ensure that all members of our community have opportunities to participate in the prosperity we create together. This morning, we will discuss the themes and specific findings of our latest economic research report titled Misaligned Opportunities. This report examines racial inequities in Northeast Ohio with particular focus on COVID-19 pandemic effects on minority communities. Increasing awareness and understanding these issues is critical to helping the Northeast Ohio region achieve a truly vibrant economy. This is the second edition of Misaligned Opportunities. We introduced the initial report last year as a supplement to Team NEO's annual Aligning Opportunities report, which provides a clear assessment of in-demand jobs, the availability of trained workers to meet demand, and a picture of what skills and training our workforce needs to fill them. The first edition of Misaligned Opportunities illustrated the contributing factors behind the gap in economic outcomes among communities throughout Northeast Ohio. Thanks to all who engaged in conversations about our first report to help us understand opportunities for further exploration and potential impact. This report and our program this morning continue that vital conversation. In just a moment, Team NEO Vice President of Strategy and Research, Jacob Doritsky, will take us through the insights included in this year's Misaligned Opportunities report. And later, Greater Cleveland Partnerships, Brian Hall, will moderate a panel discussion including Debbie Connolly from Highland, Terrell Dillard from Zaymat Distributors and JanPro, and Victor Ruiz from Esperanza. I look forward to learning from each of our esteemed guests, and I'm grateful for your willingness to share time, perspectives, and insights this morning. But first, I'd like to introduce Alan Nevel, Senior Vice President, Chief Diversity and Human Resources Officer at MetroHealth. He is here to share his perspectives on the opportunity to build deeper talent pools and pipelines through focused DE&I strategies, as well as the value of our Misaligned Opportunities findings. As Senior Vice President, Chief Diversity and Human Resources Officer for MetroHealth, Alan is responsible for driving MetroHealth's people strategies associated with talent acquisition and development, total rewards, performance management, workforce engagement and optimization, diversity, inclusion, and community involvement. As a native Northeast Ohioan, Alan is heavily involved in his community, supporting organizations like the Urban League of Greater Cleveland, Karamu House, the Diversity Center of Northeast Ohio, Recovery Resources, Cleveland State University, National Society of High School Scholars, and African American Leadership Academy. Alan, thank you for joining us today and sharing your perspectives.
Thank you very much for having me.
Let's start out very simply. How do you drive DE&I related strategies within MetroHealth?
Well, I would say I'm responsible, but driving the effort is really all 7,800 of our folks across our entire family at MetroHealth. We focus on inclusion first, because without inclusion, in our opinion, diversity really doesn't matter. So we focus on creating a psychologically and physically safe environment for all of the unique, diverse perspectives of our 7,800 family members to be shared at the table. We focus then on how do we leverage that diversity that each and every one of us brings in order to maximize the patient experience, the employee experience, and ultimately for our community as well.
Share with us a little bit about the journey your organization has been on in identifying ways to strategically connect diversity, equity, and inclusion-oriented strategies into what you do every day.
Well, without talking about where we are currently, let's go back a little bit to the founding of our organization, because I think that's very important. We were founded over 180 years ago under the basic premise that we would take care of you regardless of how sick you are and regardless of your ability to pay, which automatically causes us to focus very heavily on underrepresented populations. When we look at our patient demographics, about 80% of our folks are either on Medicare, Medicaid, or are uninsured or underinsured. Those are the folks who typically slip through the cracks. So given that we were founded under that principle of taking care of the underserved, you then take that and look at our values, which are known as the STAR IQ values. That's an acronym serving for service to others, teamwork, accountability, respect, inclusion, diversity, and equity, and lastly, quest for excellence. So at the MetroHealth system, we're really focused on living our values, our mission and our vision that's over 180 years old. How do we bring that to light today? We've been doing a lot of work in terms of inclusion, diversity, and equity for years. But with the murder of George Floyd and the COVID pandemic, literally 2 pandemics occurring at the same time, we saw an opportunity for us to really change the trajectory of what we were focused on.
So as we think about your mission, the population you serve is critically important for you, I would imagine, to make sure that your employee base very much reflects the nature of your constituents.
Absolutely. That's an imperative. And what we've been focused on is how do we ensure that across our entire organization, both on the clinical side as well as the non-clinical side, we're reflective of our patient demographics and the community as a whole.
How has the misaligned opportunities and aligning opportunities reports, how have that informed some of the thinking that you and your team have brought to your strategies?
I think the report has not only validated a number of our beliefs and assumptions, but also given us an opportunity to look at what can we do to perhaps tweak some of our processes, our systems, in order to get the desired outcome. When you look at the report, 2 things really stood out for me. When we look at the current occupations within this region, held primarily by those of Asian, African-American descent, as well as folks who self-identify as Hispanic or Latino, you'll notice that there are some trends there in terms of educational background and linking that to occupation. One of the things that we noticed was the fact that digital access, the digital literacy divide, how it disproportionately impacts particularly African-Americans as well as folks who self-identify as Hispanic. That's something that we can address with what we do. We've got a number of partnerships, for instance, a job access center partnership with Tri-C, Cuyahoga Community College. We leverage that partnership in order to really begin to address digital literacy, workforce strategies, understanding what it takes to write a resume, how to interview, all of those skills that are really important in order to have those doors open for folks.
One of the things that we have found is that members of the workforce development community or higher ed have valued the fact that aligning opportunities and misaligned opportunities is bringing data and statistics to the table to define the gap, whatever they're looking at. Are you finding that valuable as you interact with those partners in the system that you think are so important to partner with in order to drive different outcomes?
Absolutely. Another thing that stood out in the report for me was the very, very low percentage of minority-owned businesses in this region. We have supplier diversity initiatives in order to ensure that both women-owned, veteran, disabled-owned, as well as underrepresented minority-owned businesses have the opportunity to do business with the MetroHealth system. By looking at the data that you provided in the report, it validates our thoughts and really helps us look at how do we meet those small businesses where they are? How do we do some outreach rather than expecting them to come to us? How do we meet them?
So it's helping you engage your partners and other stakeholders very differently in ways that are aligning maybe your strategies, your interests better with theirs.
Absolutely. It also serves as an educational tool for all of the folks who have P&L responsibilities within our organization who go out and procure services from different businesses. So providing them with not only the heartfelt knowledge, but also from a heads approach, because we take a head, heart, hands approach, providing them with the data in order to then act and behave differently to engage with these businesses to provide them with an opportunity. We think about small businesses are truly the lifeblood of this country.
Let's pick up on the impacts of COVID, in particular, on ways you have had to change your internal processes to manage your employee base or even attract or retain the employees you have. Share some perspectives on that and how that relates to the whole question of expanding your talent pools and in the context of diversity, equity, and inclusion.
We ended up having to have over 1,000 of our colleagues across the system begin to immediately work from home. Not having any preparation for that, but we had to literally shift on a dime, turn on a dime. And that required a wholehearted effort across both functions, departments, leadership, as well as employees to all operate in a swift manner. When you think about that, 1,000 people who used to sit at a desk and now they have to work from home. Well, do they have the proper software, hardware, bandwidth access, all of those things in order to do their job effectively? When you sit in an environment with your colleagues on a day-to-day basis, that becomes part of your family, if you think about it. So when we look at how do we need to adapt, we've had to look at our job descriptions. Have we had to modify some of them? Are there new jobs that are being created as a result of the pandemic? All of those things from a human resources perspective, we have to take into consideration.
Well, I would imagine though also as you think about operating virtually now, different life circumstances that people have now come into the equation in ways
Absolutely.
that you never would have had to think about before.
Yeah, because one thing that we didn't mention, education. Those folks who are working parents all of a sudden had to not only continue to work from home, but also their children were home. So they're playing the role of not only employee, but also in many instances, teacher, educator, facilitator. And that's just an additional responsibility. And we had to understand that we needed to be very flexible in order for families to be able to get things done the right way, or else the children would suffer.
If there was one or two things that as you think about building a more inclusive, diverse, deeper talent pools, what were the one or two things that come to mind for you that you try and do as a leader of all those efforts within MetroHealth?
We try to make sure that everyone has equitable access to services, tools, resources, to really change the trajectory of their lives. I mentioned the fact that we've got the Job Access Center with Tri-C. We also have the only high school of its type located in a hospital in the country, and that's the Lincoln West School of Science and Health, because we realize that if we can address some of the challenges that our youth face, we can eliminate those by the time they're adults. So really looking at it from an end-to-end perspective, we realize that those students will ultimately be our patients as well. So really looking at it from a how can we impact the overall well-being, the overall health of everyone within the community.
You spoke earlier about educational attainment and how you noted in the report the differences based on different demographic groups. You also just mentioned that you're engaged in the education space. What are the few things that we ought to be thinking about in terms of encouraging greater achievement across a range of job categories that would help move the ball down the field, if you will, not just from an access and achievement perspective, but create more equity across the different demographic groups?
I think one of the things is to engage the community. This isn't something that only big businesses will be able to figure out. This isn't something that just we in healthcare can figure out. We all have to come together. And I think the key around this is to listen with empathy and understand that the challenges that one person may have, they may be very different from another, but really creating that safe space to engage in dialogue. From an education perspective, I think we have to understand that there are a number of challenges that folks face, and those are typically known as the social determinants of health, that can really have a negative impact on learning. If I'm worried about having a roof over my head, having a job, having food in the refrigerator, it's highly unlikely that I'm going to be focused on other things. So understanding how those social determinants of health impact folks across this community and addressing them through partnerships. I love the fact that we've been able to partner together on some data sharing to really help make a difference in this community, but it's really going to require all of us.
So you're arguing for much greater integration of
Absolutely.
strategies across a wider range of specialty areas within economic development.
Yeah. To give you I think a really concrete example of how these partnerships have to take place. When we first began testing for COVID and then ultimately providing the vaccine, we met our patients where they were. Rather than expecting them to come, for instance, to our main campus, we went and reached out directly to those who are homeless, living under bridges. We went into the communities. We partnered with faith-based organizations in order to meet our patients where they are. That's the same thing we have to do to address any of these issues that result in these inequities that we face.
Thank you. As we think about what is required for success across all of economic development at Team NEO, we talk a lot about public sector, private sector, higher ed engagement, all brought together solving common problems.
Mhm.
How does that translate into this discussion here for you?
I think that's exactly what the formula or the recipe for success needs to be. When we talk about in our organization, when we talk about eradicating systemic racism and bias in the workplace, we articulate it in the following manner. It's not a Black problem, it's not a white problem. It's not a Hispanic or an Asian problem, it's a human issue. We all have to recapture our humanity. I think the same thing applies when we talk about partnering across different sectors. We can't point the finger and say, well, it's academia's fault. We can't point the finger and say, well, it's big business's fault or healthcare. All of us have a responsibility, in my opinion, to come together in order to develop solutions. Now, those partnerships have to include the citizens of our community. We have to engage them. We have to invite them to the table and again, provide that psychologically and physically safe environment to be heard.
One of the things we're finding at Team NEO is no matter who you talk to in the business community, number one, number two, or number three on their agenda is how do I enhance my talent pool? And so what we're finding in many of those conversations is that companies are more open to thinking about how can they deep into different demographic pools or different populations that for whatever reason they have not been as easy to access. And we're also finding in higher ed, we're finding opportunities for higher ed to lean in different ways to make access more variant so that they can, sort of accommodate many life experiences. Is that the kind of thing you're talking about?
Yeah, I think you bring up a great point because when we think about the standard job description, we have a list of requirements and then a series of intangibles. Perhaps we have to change our thinking around that and understand that there are a lot of leverageable skills that people bring to the table that may not show up in that resume. I think we have to open our eyes and understand that experience and a degree can be synonymous. Some people may not have been able to afford that degree, but if you've got someone who has 10, 15 years of experience managing people versus someone who's fresh out of school with a degree, and by no means am I dismissing education and the importance thereof, but what are we doing in terms of the value placed on that experience versus that education? So I think we really have to take a more open-minded approach and realize that the quote unquote solutions of the past aren't applicable anymore. The world has changed. The report contains a lot of valuable data. I think the question that many will have is, so what? What do we do with it? And ultimately, that's where that responsibility that I spoke of, the responsibility is a shared responsibility across this entire community. If we want to change the narrative about Cleveland, about greater Cleveland, we have to take that responsibility if we want to change it. And it's a shared responsibility across all sectors, all ages, race, ethnicity, all of the 40+ characteristics of diversity need to be represented in order to come up with viable solutions. And I honestly believe that one thing that's great about Cleveland is that we're small enough, but we're big enough where if we get this right, we can impact truly the rest of the nation and the world as well.
Thank you for that challenge. And at least in our case, what we hope is that the underlying data embedded in aligning opportunities, misaligned opportunities, and now recently lost opportunities provides a very robust data set that all the folks you were talking about can rely on to at least identify the issues in a common way so that we can then think about aligning solutions toward closing the gaps that we're talking about.
Absolutely.
Alan, thank you once again for your time today and for your ongoing work to build a more vibrant economy in Northeast Ohio, one that is talented, equitable, innovative, resilient, competitive, and prosperous. We are grateful for your leadership and your impact in the Northeast Ohio region. At this time, we'd like to pause to thank our sponsors for making the Misaligned Opportunities research and this event possible.